Now we're going to talk about insomnia. And what is insomnia? Insomnia is actually one of the most common sleep complaints in the industrialized world. Complaints can range in 30 to 40% of people, but only 6% have the actual insomnia diagnosis. Insomnia disorder is defined as a subjective report of difficulty with sleep initiation, duration, consolidation, or quality that occurs despite adequate opportunity for sleep, and the result is some form of daytime impairment. Blah, 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 blah. You're not sleeping. You're awake when you're trying to sleep. That's insomnia. There's things that you can't define, but you know it when you see it. Insomnia is one of these. The view that I have on insomnia is, number one, insomnia is a symptom. Well, fever can be a symptom as well. But where's the fever coming from? Is it from a wound? Is it from influenza? Same thing with insomnia. And it could be a symptom of anxiety, of pain, of sleep apnea, of restless leg syndrome. There's a number of things that can cause insomnia. Another view that I have on insomnia is that it is not a night disorder. There's a lot of things that happen during the daytime that influence our inability to sleep at night sometimes. And if we have a bad night of sleep, then the whole next day we may feel some of these consequences. So I view insomnia as a 24-hour disorder because of the daytime influences that cause it and affect. Now, one of the most common causes of insomnia is called psychophysiologic insomnia. And it doesn't mean that you're psycho. What it means is that some people have a difficulty sleeping because something is on their mind. What's on their mind is that they have difficulty sleeping. The more that you think about something, the more true that it'll become sometimes. And you can't just push symptoms away. Now, if I tell you, don't picture a red ball, don't picture a red ball, don't picture a red ball, don't picture a bouncing, throbbing red ball, the more that you say don't do something, the more that you actually picture it. And that's actually something that very commonly happens at night. I can't sleep, I'm not sleeping. It's 2 a.m., we're watching the clock. How come I can't sleep? I'm going to be tired the next day. The more that you actually think about the fact that you're not sleeping, the more that actually becomes the cause that you're not sleeping, or sometimes a contributing factor as well. Believe it or not, medications is actually not the first line therapy for insomnia, but behavioral sleep medicine approaches are the first line treatment. Such treatments do include sleep hygiene, stimulus control, sleep restriction, relaxation training, cognitive therapy, and circadian rhythm entrainment. Now, this is a series of studies that actually have been repeated many, many different times, where they take a look at behavioral approaches to insomnia as opposed to medication approaches. And one thing that's been seen many times is that if you give a group an FDA-approved medication for insomnia, they all generally do better within those first 2 months. However, at the end of a 2-year period, they really never are better off than where they started. Now, they've given another group a combination of an FDA-approved medication, and the combination is that they combine it with some of the behavioral sleep medicine techniques. Now, they've been shown to do even better than the group that was only given medication alone, in the short run and in the long run as well. Now, they've taken another group and they didn't give them any medication at all. They gave them behavioral sleep medicine, different behavioral techniques for sleep. They did better than the medication group in the first 2 months, and they did best overall, the winner.